Namaste everyone, welcome back to my channel Physio Vitals. Today I am back on the topic on cranial nerves. So today we'll dive deep into the fascinating world of cranial nerves. Whether you are a student, a healthcare professional or just curious, this video will give you an easy to understand breakdown of their origin, course and function. So let's get started. So the cranial nerves are a crucial part of the human nervous system, playing a vital role in sensory perception, motor control and autonomic regulation. So this presentation will delve in the intricate anatomy, origin, course and clinical significance of these remarkable neural pathways. So the first thing first, what are cranial nerves? So cranial nerves are the 12 pairs of the nerves that emerges directly from the brain and the brainstem, controlling various functions like movement, sensation and reflexes. So these nerves play a crucial role in the head, neck and body. So there are 12 cranial nerves. The human body is equipped with 12 pairs of cranial nerves, each with unique functions and properties. Sensory and motor function. The cranial nerves manage a wide range of sensory and motor functions from vision and hearing to taste and facial expression. There is also an autonomic regulation. So several cranial nerves also play a role in regulating the autonomic nervous system, controlling involuntary bodily functions. So the visual text. So we'll see the 12 cranial nerves one by one. So they are numbered in Roman numbers 1 to 12 based on their position, and each nerve has its unique job, from smell to eye movement to facial expression and beyond. So cranial nerves have you covered. So here are the origin and the course. So let's talk about their origin. So cranial nerves can emerge from the brainstem itself or from the brain itself or the brainstem. So the first two nerves, the olfactory and optic nerve, originates from the cerebrum, where the rest comes from various levels of brain stem. Okay, so brainstem origin. The cranial nerves originate from specific nuclei which are located within the brainstem, including the midbrain, pons and medulla. Traversal course. The nerves have traversed intricate pathways passing through various foramina and fissures in the skull before reaching the target tissues. Peripheral distribution. Finally, the cranial nerves distribute and innervate specific regions of the head, neck and the upper torso. So, the cranial nerve insertion and action, the olfactory, optic, the sensory function, motor function and autonomic. So, in sensory function, we have cranial nerves responsible for vision, hearing, taste, smell and other sensations. Optic nerve, vision, olfactory nerve, smell and gustatory nerve, taste. So the olfactory nerve starts from the olfactory bulb in the forebrain and is responsible for your sense of smell. Its course is quite short as it goes from the nasal cavity directly to the brain. The optic nerve originates from the diencephalon. Its course goes from the retina to the brainstem, transmitting visual information. Okay, next I'll tell you about autonomic. Vagus. The vagus nerve is a unique extending from the brainstem into the chest and abdomen, influencing the heart, lungs and digestive system. So simply the course of each nerve varies depending on its function. Some nerves like the trigeminal nerve branch into the different areas, providing sensory input to the face, Others, like the facial nerve, control motor movements for expression. So the insertion and action for the facial nerve I'll cover. So let's get into the insertion and action. The term of insertion of each nerve either ends in a muscle, gland, or the sensory organ. For example, oculomotor nerve inserts into the several muscles controlling eye movement. Facial nerve inserts into the facial muscles that help us smile, frown, or raise an eyebrows. So, oculomotor, the third cranial nerve, oculomotor nerve, inserts into 4 of the 6 muscles that move your eye, controlling most eye movements. Facial nerve, on the other hand, controls the facial muscles, facial expressions, and also has a sensory role in taste for the front anterior two-thirds of the trunk. Vagus extends beyond the head and neck, influencing the heart rate, digestion, and even speech. Okay, so each cranial nerve has a distinct action, whether it's moving your eyes, controlling muscles for mastication, or sensing taste. So understanding these actions is very much a key to diagnose the nerve damage or the dysfunction. So the oculomotor nerve responsible for eye movement, facial nerve for facial expressions, hypoglossal nerve for anterior two-thirds of the tongue, vagus nerve heart rate and digestion, glossopharyngeal nerve for blood pressure and swallowing. So the sensory functions of the cranial nerve: optic nerve, olfactory nerve, gustatory nerve. The motor function that controls the voluntary and involuntary muscle movements are the oculomotor nerve, facial nerve, and hypoglossal, whereas the autonomic nerve are the vagus and glossopharyngeal nerve. So the surgical importance. So detailed knowledge of the cranial nerve's anatomy is crucial for neurosurgeons performing delicate procedures in head and neck region. Clinical assessment. Healthcare providers use cranial nerve examinations to diagnose and monitor various neurological conditions and its disorders. Anatomical variations. Understanding the potential anatomical variations of cranial nerves helps clinicians interpret and diagnostic imagings and plan the interventions. Trauma and injury. Injuries to the head or neck can damage cranial nerves, leading to the wide range of sensory, motor, or autonomic impairments. Clinical significance of the cranial nerve. So dysfunction or any damage to the cranial nerve can result in a variety of neurological conditions such as facial paralysis, vision loss, and swallowing difficulties. Diagnostic importance. A careful assessment of cranial nerve function is crucial part for neurological examination, helping clinicians identify the underlying cause of a patient's symptoms. Treatment strategies. Understanding the specific cranial nerve involvement is essential for developing effective treatment plans, which may include medication, rehabilitation, or surgical interventions. Cranial nerve pathway and disorder. So visual disorder, optic nerve 2 and oculomotor nerve 3 disorder can lead to visual impairments, double vision, eye movement difficulties. Hearing and balance, auditory nerve and the vestibular nerve disorder can cause hearing loss, tinnitus, and balance problems. Taste and swallowing. Glossopharyngeal nerve, hypoglossal nerve disorders can affect the taste perception and swallowing function. Whereas the facial function, the facial nerve disorder can lead to facial paralysis, muscle weakness, and impaired facial expression. So, thank you. And the key takeaways from this presentation are the crucial role of cranial nerves in sensory, motor, and autonomic function, as well as the clinical importance in neurological assessment and treatment. So, let me know if you'd like the video. Don't forget to like, share, and subscribe. Stay tuned for more such videos. Keep learning. God bless you all. Thank you.